Hello, my name's Paul Kerr and I'm lead for clinical skills at University of Exeter, and this video is just going to be a very brief recap of your OSCE training. It's going to take place on the day of the exam, so it should take about 5 minutes, and then we'll send you off into your huddles, which is the more important bit of your training today. So we'll just run through the same things, the purpose of the exam, and the question you're asking yourself, whatever year you're testing, is this student ready to progress into a subsequent year? If we have patients in watching this video, then just some pointers for you. Please make sure you get together as a group in your huddle in a minute and agree roughly how you're going to run the station and answer any questions you might have with your examiners. Please give honest answers. Don't try and trick the student or hold back. Just answer the information, give the information the student's asking for promptly. You can feedback on the student afterwards on the form provided, but please don't give them any verbal feedback. And that feedback is what we call formative. So you can't fail the student, but you can give them some advice, either if they've been particularly good or particularly weak. And it's very important that you do that. And please let a member of staff know if you're not feeling well or if you're having any problems. We have backup patients and actors available. You don't have to tough it out if you're feeling dreadful. Similarly, for actors and simulated patients, go into the huddle and make sure that you're all acting in a similar manner. Please stick to your script. I'm sure you will. And please stay in the station when you've finished your bit. Just please stay and wait while the examiner and the student go through the Viva section. Unless the station instructions are directing you otherwise, we're looking for moderate performances in general. I'm sure you know what I mean. And again, you can feedback on the student afterwards on the form provided. Don't give any verbal feedback, and that is formative. It won't fail the student. Okay, back to our examiners. This scoring. You have got 3 options for most stations. You will have a checklist, and for each checklist item you can give unsatisfactory, which means the student has omitted that item or performed it so poorly as it's doubtful, benefit or dangerous. It could be borderline. It's very important you liberally use borderline. It doesn't mean you're failing the students. It means that I am uncertain whether to give satisfactory or unsatisfactory. Some of the more basic stations, we may not give you that option. And satisfactory means performed to an acceptable standard. So, for example, for social history, unsatisfactory would be omission. A borderline mark would be the student's just done a brief check of smoking or alcohol, and a satisfactory mark would be a comprehensive coverage of employment, home circumstances and care needs. For something else like an examination station, for palpation, if the student forgets to palpate the abdomen, that would be an unsatisfactory, or if they repeatedly hurt the patient. Borderline might be they perform it, but they do it standing or don't watch the patient's face. And satisfactory means they perform it with the correct technique and find any clinical signs if they're present. Please use your judgment with the scoring. Please use a spread of marks. Don't get everybody 20 out of 20 or give everybody borderline for everything. The way the maths it works on this requires you to use a spread of marks. And remember, borderline does not mean fail. The students will have hundreds of individual checklist items, so you do not need to agonize over a single item. Go with your best judgment and move on, and do not worry about it. And remember, some stations have only the satisfactory or unsatisfactory option. In the later years, the students might be asked to give a summarising statement as part of their Viva. An unsatisfactory summarising statement would be a near full repetition of the history or omission of critical information. A borderline summarising statement would be a summary of the key points, but no diagnostic or management strategy. And a satisfactory summarising statement would be a summary of the key points and some thoughts on the diagnostic or management strategy as is appropriate to the station. You're also asked to give a global score. This is an independent overview of the student's global performance, and you need to know that that can be amended. So you might give the student an unsatisfactory, but using a technique called borderline regression method, we might change that. Here are the options on the global score. Unsatisfactory is performance with significant omissions or potentially dangerous. Borderline would be performed with significant deficiencies. Satisfactory is performed to the expected standard. Very good would be a notably strong performance, and excellent is outstanding. There will be electronic marking. We will tell you your letter of the day. It will be up on a board in the room that you're in now usually, and there are plenty of us around to help you if you're having a problem with the electronic marking on the iPads. And here's a quick recap of how to use the iPads. The system's called Practique. You'll be asked to open the session on the front of the iPad corresponding with the time that it is. So you click on there, and then it will ask you to input an ID code. So it will be the letter of the day, and then usually followed by a number, which will be available in your packs. And again, we will help you with that. So you put your code in, and that will allow you to start marking the students. And one useful thing about the Practique system is you can turn the iPad on its side into landscape mode, and it will allow you to bring up documents like the study guide that the students have, and that can help you refresh what the students have actually been taught on that subject. A few things about examiner behaviour. Please turn your mobile phones off and hand them in at the desk, and someone can take any messages for you. Please keep your interactions neutral. Please keep your marking sensible. Don't give the student 20 unsatisfactories and then give them a global score of excellent, and don't do the opposite and give 20 satisfactories and mark them as borderline. It messes up our statistics and stops the exam from working. And please don't place an extreme emphasis on a single point. You might think the jugular venous pressure is the most important thing in the world. Our view is that everything on that checklist item is of equal import. But if you are upset about something on mark scheme, don't take it out on the exam. Please let us know and we can review it for subsequent years. You can feedback on professionalism of the student, either informally or formally, and that might include things like personal hygiene, attire. It's pretty common sense around attire, but we have hospital policy to help guide us because it can be a sensitive area. And this is from the Exeter policy. Staff are expected to maintain a professional appearance and instill public confidence. You're not meant to have large amounts of your body on show, and hair and beards are expected to be neat and tidy, and tattoos are meant to be covered, or if they can't be covered and they're potentially offensive, then you may have a problem and you could feedback on that should that come up. Students aren't wearing scrubs at the moment for the exams. They may in the future. And in general, when we talk about professionalism, we're talking about putting the patient first. So we're thinking there about the student who becomes impatient with an elderly patient, for example. We do want you to feedback in the 2 minutes you have between stations, particularly for students who are failing or borderline. You don't have very long to write, and we're only expecting brief notes. If you're giving feedback, please keep it specific. Say you did not examine the nails. Don't say you are rubbish at examination. Say you've made it clear, you need to make it clear in your introduction what your name and role is. Don't say dreadful introduction. Say, I suggest you practice talking more to patients. Don't say it looked like you'd never met a patient. You get the idea. The students do see the feedback, they do scour through it, and if it's unpleasant in any way, they do take that very to heart. We'd prefer you didn't discuss the student performance with the patient or actor who's with you. If you do discuss it, then please complete your scoring before you have any discussions, and bear in mind it's possible for the students to overhear what you're saying. So personally, I would avoid it. The students should stay in the room until the station bell goes. And if you're in a station that has a Viva element, usually the first question is the summarisation of the case. The second question will be quite specific to the station. The third question is your choice as an examiner. And in general, we're looking for you to help the student address any deficiencies thus far in their performance. If they've done a perfect performance, then you can ask them something quite difficult and give them a chance to shine. You can greet the student if you want, although generally they tend to be appropriately focused on the patient, but don't give them any feedback. And we'll let you know if any external examiners are present. And they might ask to join you. They are marking us, not you. Just a few year-specific tips. If it's a year 1 year, this is their first ever live exams, and they've only covered a limited part of the curriculum, and they will have a very rote approach. Year 2, in 2019, this year, this will be their first OSCEs, and they're bound to be extremely nervous. And the question we're really asking is this student ready for the clinical environment? And are you happy that the student is going to be seeing patients at times unsupervised on clinical placement? And for year 4, the student after year 4 will go into year 5, deemed the preparation for practice year, where they are semi-independent. And ultimately, the year 4 exam will form the clinical skills component of the GMC's new medical licensing exam. So in year 4, we're asking, is this student ready to be semi-independent in year 5? Okay, so we're going to ask you in a minute to go off into your huddles. This is where you can agree as examiners and patients and actors how you're going to run the station to make sure that you're all running it in a similar manner. Look at another couple of things. We might use the data from the exams for audit education research. Please let us know if that's a problem. All data we use is anonymized. The GMC now expects us to pick up examiners who are particularly hawkish or dovish and offer them additional training. And if that additional training does not work, to stop you being an OSCE examiner in future. It's only a minority of our examiners that are outliers, but we will be forced to act on that in future. And hopefully you are here on time because you'll be watching this. Thank you for being an examiner. Please give us any feedback about the exam to help us improve it for next year. Please trust your judgment and experience. It is only one station you're marking. You will not destroy someone's career if you fail them. Please write feedback for our students. And before you go into the huddles, please confirm any fire regulations and other logistics with the local team now. Thank you very much for listening.